Welcome back to 1011 News at noon. September is Vascular Disease Awareness Month. CHI Health Nebraska heart vascular surgeon Dr. Callie Roberts is here with us today to share why our vascular health is so important. Dr. Roberts, thank you so much for being here.
You're welcome. Thank you so much for having me.
Yeah, so how does our vascular system really play into our heart health? Why is it so important?
Yeah, so I'd almost start with it. It's kind of a misconception, and that the vascular in my world is kind of all of the vessels except for the heart and the brain.
Okay.
However, if you do have or known peripheral arterial disease, so disease in any of those other vessels, you have about a 60% chance of having coronary artery disease or disease in the heart vessels that then puts you at high risk for a heart attack or something like that.
Interesting. Yes, of course, everything's connected. But yeah, when I hear vascular, I automatically think of the heart, so that is kind of interesting that it's not necessarily concerning that.
Yes.
Yeah. Well, what are some signs or symptoms someone might have if they have vascular disease?
Sure. So the most common is asymptomatic or not having any symptoms. Then probably the one that we think about the most is peripheral arterial disease, or in the legs, where you have symptoms of like claudication, which is pain or burning when you walk, like a Charlie horse kind of. You can get coolness, tingling, numbness in the legs or feet. You can have more serious symptoms where you have severe pain all of a sudden in the legs or feet, or also strokes or symptoms like that would be then from the carotid artery disease. Those are kind of the most common symptoms, and then obviously heart attack type symptoms are the other kind of classic.
Okay. Now, a vascular surgeon, so interesting. Can you explain more about what it is exactly you do?
Absolutely. So, it's Vascular Disease Awareness Month, so I'm like extra excited that we're here in September.
Yeah.
But basically, a vascular surgeon, the simplest is kind of like I said, that we take care of all of the blood vessels except for in the brain and the heart.
Okay.
So the three kind of most common are the carotid arteries, so that if those get blocked off can cause a stroke. The aorta or the aortic aneurysm, so in the belly, are kind of the most common, where the artery kind of balloons out, and we can fix that. Or the vessels in the legs, so the peripheral arterial disease that can go anywhere from no symptoms to pain when you walk to having wounds. So we treat a range of all of that, plus all of the veins too. And a lot of times it can be managed medically and you don't need surgery. And there's other times that we can do surgery to prevent things or make you feel better.
Well, wonderful. Thank you for explaining that. Now, we want to let folks know that you do have an upcoming opportunity to take advantage of a free screening event, correct?
Yeah, absolutely. So I think it's on September 20th, this Saturday from like 9 to noon. There are limited spots, so you have to call the number to get scheduled. Basically, we screen those three things. So carotid artery, so an ultrasound of the artery, an ultrasound of the belly to look for an aneurysm, and then ankle brachial pressures, or ABI, to check for any significant disease in the lower legs. And I think that the screening is really helpful for people that are at risk, because you can catch it, because a lot of times they're asymptomatic or don't have any symptoms, and we can modify, and a lot of times just even medicines are all you need, and we can help prevent things from getting worse.
Yeah, hopefully folks can take advantage of that screening event. Dr. Roberts, thank you so much for being here.
Absolutely. Thanks so much for having me.
And we'll be right back with a final check of Brad's weekend forecast.